Thank you for being here. I'm Mayor John Ostenburg, Village of Park Forest. I want to welcome you to our community, those of you who have come from other villages, those of you who are park foresters. We're glad that you have taken an interest in this important topic and are here with us today. You know, this is a program that has been put together all by citizen volunteers, and I think that's an important thing for us to stop and think about. You know, citizens playing a role of helping in our community to make all of us aware of important issues, to bring them to us and to help us form some method for dealing with problems. We're very much oriented toward the idea of solutions. We're not here today to point any fingers or make any accusations or anything of the sort. Rather, we want to find solutions for a major problem that's facing our region. And I think the wonderful speakers that we have this afternoon are going to help to articulate that message. And at the conclusion of our presentations, we're going to ask for the citizens, for you who are present here, to offer comments, suggestions, questions, etc., so that we can try to put together an agenda for a citizen lobby. And that's our purpose. Now, I want to just compliment the Citizens Advisory Council for the good work that it's doing, because these are 80 volunteers who just came forward when I asked them to volunteer. I did not ask them individually, I just put out a general request to the community. And 80 people came forward, and they've been working on some pretty outstanding projects in our community. One of which we completed back before Christmas, which was our big coat drive. We did a drive for Respond Now to help those who were without to have something at the Christmas season. We thought we'd collect maybe 100 coats. That was our goal. We ended up with more than 500 coats and other clothing items. And that was all because of citizens coming forth and helping us. That's the kind of work that the Citizens Advisory Council is doing. The names of those members are on the back of your program. At the bottom of the back of your program are some particular people who have worked extra hard in putting this together today. We want to thank all of them for that. You know what? John Kennedy supposedly said one time when he had a dinner at the White House that had a lot of intellectuals there, including some Nobel laureates, and he said something on the order that it was the greatest collection of intelligence that dined at the White House since Thomas Jefferson ate alone. And I don't think our panelists collectively compare to Thomas Jefferson, but otherwise I think we have the greatest collection, closest to Thomas Jefferson's individual wit and wisdom that we could possibly put together. And we're so appreciative of the fact that they have volunteered their time to be with us on this Sunday afternoon so we can explore this issue and we can then seek to find some solutions. So I'm going to now introduce our Master of Ceremonies, probably an individual who is known throughout the state of Illinois as the most aggressive and successful lobbyist for citizen issues, William McNary, the Executive Director of Citizen Action. William.
Well, good afternoon. Good afternoon. My mama always told me you can tell what kind of a crowd you're standing in front of by the way they greet friends or by the way they greet strangers when they greet you. So let's try that again. Good afternoon. That's more like it, South Suburbs. You all make my mama proud. Thank you, Mayor Ostenburg, for that kind and overly generous introduction. Every time I hear an introduction like that, it reminds me of a funeral I went to one time. The minister was saying what a loving husband he was to his wife, what a kind father he was to his children, what a generous benefactor he was to his community. About 5 minutes into that eulogy, the widow nudged her daughter and said, "Would you go up there and see if that's your daddy in that casket that they're talking about?" Thank you, Mayor, for that challenging introduction. And welcome to the special forum sponsored by the Park Forest Mayor Citizens Advisory Council, focusing on the healthcare needs of South Chicago and the South Suburban residents. As Citizen Action Illinois, we say there are three kinds of people. There are people that make things happen, there are people that watch things happen, and then there are people that don't know what's happening. I can't think of any place else in the world I would rather be on a Sunday afternoon than right here in Park Forest, Illinois, in a room full of aggressive progressives, people who are not just content to spectate or speculate or postulate on pontificate about life, but people who are active participants in the movement for social justice and social change. I truly believe, because you all are gathered here this afternoon, that people will live longer, that people will enjoy better healthcare outcomes, and people will enjoy a higher quality of life because of the work that the advocates that are gathered here have done, are doing, and most importantly, what you all are getting ready to do. Let me first of all thank in advance all of the speakers and presenters who will follow me. I want to thank you for giving our heads good information. Thank you for giving our hearts good inspiration, and thank you for giving our feet good instruction. Having me speak at a forum like this is never a 50-50 proposition, I guarantee you. I've already and will already receive more wisdom than I can possibly give. So with that disclaimer, let me tell you, like Kim Kardashian told her last husband, I won't keep you long. Let me just a couple of words before I bring on our keynote speaker. We, the people of the state of Illinois, grateful to Almighty God for the civil, political, and religious liberty which He has permitted us to enjoy, and seeking His blessing upon our endeavor in order to provide for the health, safety, and welfare of the people, maintain a representative and orderly government, eliminate poverty and inequality, assure legal, social, and economic justice, provide opportunity for the fullest development of the individual, ensure domestic tranquility, provide for the common defense, and secure the blessings of freedom and liberty to ourselves and our posterity, do ordain and establish this Constitution for the state of Illinois. All 118 representatives in the state of Illinois, all 59 senators, on the day they're sworn in, they put their hand on a Bible and put the other hand in the air and swear to this particular Constitution, this particular Illinois Constitution. That's the preamble. The recent closure of Oak Forest Hospital, the recent announcement to close Tinley Park Mental Health Center without a plan to care for its mentally ill, the lack of a trauma center here in the South Suburbs. Outside of Tinley Park, the largest mental health facility in the state of Illinois is the Cook County Jail. And what are these closings motivated by? By the need to save money. These solutions are penny wise and pound foolish. For every dollar in preventative treatment that the government spends, it saves $10 in additional costs. The closing of Tinley Park alone will result in a loss of $50 million in economic activity. The Southland has the highest property tax rates in Illinois, some of them. The Southland has some of the highest unemployment rates in Cook County. Foreclosure rates are at great recession levels. We will not continue to balance the state budget and the county budget on the backs of the most vulnerable. We can stop jobs from being lost. We can stop people from being hurt. We will let the elected officials live up to their constitutional responsibility. Our voices have to be heard. Our stories have to be heard. And that's why you are here today. When you come up before these experts and elected officials, speak your truth with conviction, with compassion, and with clarity. And then we will go and do the hard work of fighting for a South Suburbs with strong schools, strong communities, and a strong economy. Let's fight like our lives depend on it, because you never know. It just might. Our first speaker, our keynote speaker today, began service in the United States House of Representatives in 1995. He was the 91st African American ever elected to Congress. He currently sits on the powerful House Appropriation Committee. He is the fourth most senior Democrat on the Subcommittee on Labor, Health and Human Services, Education and Related Agencies. He's an author of 3 books. He resides in the 2nd Congressional District of Illinois with his wife, Sandy, who's the Chicago 7th Ward Alderman. There is no greater champion for racial and social and economic justice than the man who was recently re-elected in the Democratic primary, the victor in the Democratic primary for the 2nd Congressional District, the now and future Congressman of the 2nd District of the state of Illinois, Congressman Jesse Jackson Jr.
Thank you, Mr. McNary, for that very kind and very generous and very thoughtful introduction. Today I want to speak from the subject, healthcare as a human and a constitutional right. The need for a trauma center to serve the residents of the South Suburbs. I want to first begin by recognizing Park Forest Mayor John Ostenburg for his extraordinary leadership, for his friendship, and for the leadership that he has provided not only this village, but has also provided our region. Please give John Ostenburg a great round. William McNary, the Executive Director of Citizen Action. To panelists, Dr. Raju, Chief Executive Officer of Cook County Healthcare and Hospital Systems. To panelist Jennifer Artis. She's a movie star. I asked her for her autograph when I walked in here today. To Richton Park Trustee, Director of Public Affairs at St. James Hospital and Health Centers. Jennifer did an extraordinary job in our re-election effort, explaining the kind of work that we've done on the ground over the last 17 years. Please give Jennifer a great round of applause. Ziegel, Deputy Fire Chief of the Village of Park Forest. To Reactor and a good friend and a solid state representative for our region. Please give Anthony DeLuca the 18th. To Reactor and State Representative Mary Flowers from the 31st House District. I don't know if I saw Mary here yet, but I'm sure she's in and around. Give Mary a round of applause. Commissioner Deborah Sims in the 5th District. Give her a great round of applause. I want to acknowledge, before I begin my about approximately 12 minutes of remarks, Donna Miller, who ran an important race in the 15th District, is one of the health advocates of our region, a woman who has extraordinary knowledge, who comes from a legacy of great leadership. State Representative David Miller, Dr. David Miller, did an extraordinary job for his years of service to our region. Please give Ms. Miller and Representative David Miller a great round of applause. Down and one to go. Without being partisan, I want to thank those of you who voted for me this past Tuesday. For those of you who voted for my opponent, I'm going to represent you as well and work as hard to gain your trust and your confidence and approval for this November's election and beyond. On Wednesday, I had a reporter say to me, "Congressman, congratulations on your win, Congressman Jackson. You first won office in 1995. Why did you face such a grueling primary?" And I said, I did not consider it grueling. I considered it democracy. And that's what I think we're engaged in here today, the ongoing process of democracy. We're just a group of concerned people who together are trying to figure out a solution to a problem. We're trying to determine if the people of the South Suburbs of Cook County want or need a new trauma center. And if they do, can we get it? And if we don't need a new trauma center or can't get one, what then? I want to make my position perfectly clear. If it is determined by this group and the broader community that we need a new trauma center to serve the residents of the South Suburbs, you can count on me to fight for it, win or lose. And if it's determined that we don't need or can't secure a new trauma center, but we need to improve existing ERs, our urgent care units, our medical facilities and services, and update and modernize our equipment to improve our quality of patient care, you can count on me to fight for that as well, win or lose. I think everyone here recognizes that we're currently operating in difficult economic and political terrain. A conservative Congress seems more determined to cut than to invest, but I continue to fight for investments in infrastructure, education, healthcare, housing, the environment, renewable energy, and more. Investment in the future is the best way to grow this economy, create aggregate demand, our greatest economic need, and the fastest way to reduce troubling budget deficits and our national debt. I've delivered for this community in the past, and I'll fight to deliver for this community in the future. I brought to the district more than $100 million for healthcare facilities and healthcare programs in the last 17 years. That money includes a new emergency room at Roseland Hospital, the construction of a new clinic at Altgeld Garden, the improvement of our hospitals serving Chicago and its South Suburbs, including Ingalls, St. James, South Suburban, and Trinity. I've also secured funding for research and new equipment at regional hospitals such as Rush, the University of Chicago, and Northwestern Memorial. Additionally, I've secured tens of millions in appropriations for neighborhood clinics and local family health care providers, including our office, Family Christian Health Center, La Rabida, Southland Healthcare, the Healthcare Consortium of Illinois. Salim Al-Nuruddin, where are you? Give Salim Al-Nuruddin a great round of applause. Chicago Family, Access Community Health, and Metropolitan Family Services. And if you've been watching TV or listening to the radio in the last few weeks, you know that 10 years ago I earmarked $100,000 to launch a small nurses training program in Chicago Heights. Today, the Southland Healthcare Forum, under the direction of Jennifer Artis, is a self-financed program that has trained and placed into jobs more than 1,200 nurses and healthcare professionals in the Southland. Give Jennifer a round of applause once again for her vision. In Washington, I introduced and coordinated the passage of legislation that created the National Center on Minority Health and Health Disparities at the National Institutes of Health. That law has resulted in $1.5 billion in federal healthcare research to resolve health disparities facing minorities and underserved populations. At 4 historically black colleges, their endowments have gone from single digits to over $100 million as a result of that legislation. I also secured funding for the Institute of Medicine's 2002 study that identified ways to reduce healthcare disparities. The study was called Unequal Treatment. And this is my pledge to each of you today, Mr. McNary. From the National Institutes of Health and for the Centers for Disease Control, I want our office to send a letter based upon that which you determine, that which Mr. Al-Nuruddin determines, that which Mr. Artis determined, Madam Artis determined, that we should have the directors of these various institutes come to the 2nd Congressional District, come here, Committeeman Matthews, to Park Forest, and let us also convene this forum for those personnel who are directly responsible for knowing and providing us the balanced treatment that these studies have recommended. It's one thing for us to talk about it as citizens in action. It's another thing for us to have those who are responsible for objectively looking at the fact that the South Suburbs does not have a level 1 trauma center. We are here to say that we deserve it, that we want it now, that we are taxpayers, and we will not accept no for an answer. The story of healthcare reform actually began in 1912, when Republican President Theodore Roosevelt first attempted to pass a universal health care bill. His square deal would have guaranteed medical coverage to all Americans. In 1935, President Franklin Delano Roosevelt fought for health care as part of the New Deal. Throughout his presidency, he called health care a right for all Americans. For more than half a century, the American people sought this right. LBJ passed Medicare for the elderly and Medicaid for the poor. President Clinton and First Lady Hillary Rodham Clinton worked to pass health care reform, but failed. But we could no longer wait. And on March 23, 2010, President Barack Obama secured that right to health care legislatively. I'll say more in a moment about permanently securing the right to health care. Friday, March the 23rd, 2012, marked the 2nd anniversary of this historic Affordable Care Act. Critics tried and are still presenting it as Obama scare to drive people away. But I refer to it as Obamacare, positively. Millions of Americans now have access to better and more affordable health care. Some of the concerns you will discuss today will be met because President Obama's Affordable Care Act is under discussion. This law benefits over 45 million women in America through increased access to preventative care services without co-pays and deductibles. Thanks to the ACA's new requirements, private insurance and Medicare coverage for these services without cost sharing, and by the time the law is fully implemented in 2014, women will benefit from, among other services, mammograms, cervical cancer screenings, pre- and postnatal care, flu shots, regular well baby, well child, and well women visits, domestic violence screening, and the full range of Food and Drug Administration approved contraceptives. As the courageous Georgetown student Sandra Fluke said, women who struggle with polycystic ovarian syndrome, endometriosis, unintended pregnancy, and even the terrible consequences of sexual assault understand what it's like for someone else to make their healthcare decisions for them. New moms who need the space with their children, young women who are starting their careers, and low-income women who struggle to afford basic necessities understand the need to control their reproduction. She said, I quote, "I look forward to never again hearing about a friend who lost her ovary to a tennis ball-sized cyst because she couldn't afford to keep paying for contraceptives out of pocket. I look forward to the unintended pregnancy rate in our country, which is stuck at half of all pregnancies, finally declining. I look forward to women surviving breast and cervical cancer because they were diagnosed early. I look forward to the end of gender rating in insurance, which can inflate premiums for young women by 150% compared to their male counterparts, and which costs women of all ages an extra $1 billion per year. And I look forward to knowing that when my friends choose to start their families, they will not be faced with the 85% of individual insurance plans that do not currently cover maternity care. And they will not be labeled as having, quote, a pre-existing condition if it turns out they need a C-section. Thanks to Obamacare, insurance companies can no longer deny coverage to children with pre-existing conditions, drop you when they get sick, and place lifetime limits on coverage. Parents can keep children on their insurance up to age 26, and seniors are seeing their prescription drugs costs decrease. President Obama's Affordable Care Act was a legislative and a political victory for him and for the American people. It sent us further down the road to where every American is entitled to health care. But rights granted by legislation can be undone by future legislatures or by the courts. I want to remind you that the first thing conservative Republican governors did when the ACA was passed was to file lawsuits in federal court in an effort to declare Obamacare unconstitutional. Tomorrow, less than 24 hours from now, the Supreme Court will hear oral arguments on the issue and probably render its verdict in June or just before the 2012 presidential election. That's right, it's going to be a political decision that we, the people, will make in November. We have a 10th Amendment states' rights healthcare system. If Massachusetts wants to provide healthcare for its people, as Mitt Romney did when he was governor, they can do it. If Mississippi either doesn't want to, or can't afford to, or desires not to provide health care for its people, that's the state's choice or its predicament. The right to health care is not in the Constitution. Health care is a state right, and states can determine whether to provide care and the level of care that they want and can afford to provide it for their residents. In light of what we've been reading and witnessing in the news all day for the last several weeks, the right wing will argue that they have a constitutional right to a gun under the Second Amendment. I'm hoping that this progressive gathering of thoughtful people in the 2nd Congressional District will conclude that if someone has a constitutional right to a gun, we ought to be able to have a constitutional right to health care and a constitutional right to surgery once we get shot by somebody. Recently determined that we have an affirmative individual right to a gun. We don't have an individual right to health care. So with your stand your ground gun laws in Florida, Illinois, and elsewhere, you are likely to get shot before you get health care to handle the shot you just got shot with. And I believe that the right to health care is at least as important as the right to a gun. The U.S., the richest and most powerful nation in the world, is the only industrialized nation that does not provide comprehensive health care for all of its citizens. Indeed, we rank 37th in the world in terms of health care. We spend 17%, or nearly $3 trillion of our $15 trillion GDP on health care. Yet we have 50 million Americans with no insurance. That is a sin, Representative Riley, and it is a crime. I voted for Obamacare, even though I wanted the public option in the bill, which we did not get. And I also support a single-payer or Medicare for all health care system. But beyond even that legislation, I support and I have introduced in Congress House Joint Resolution 30, which currently has 28 co-sponsors and growing. A bill that would add a right to health care to the U.S. Constitution. It takes 2/3 vote in the House and 3/4 of the state legislatures to support it. But when you add it to the Constitution, health care will never be taken away. And just before I conclude, I want to make an observation, Mr. McNary, about text and context. My father once said that a text out of context is a pretext. When I was growing up, I just considered that to be a Jesse Jackson Sr. rhyme. But the older I get, Committeeman Matthews, the more sense that it makes. A text out of context is a pretext. When I was at Chicago Theological Seminary, we were handed a King James version of the Bible. We were also given a New International Version of the Bible, the NIV. Many of us go to church every Sunday with some version of the Bible, either on our iPad, iPhone, or in hard form. When I was at the seminary, they also handed us the 3-volume masterful work by Arthur Gibbons called The Decline and Fall of the Roman Empire. It was important for us, while I was a seminarian, to read the Bible in the context of the times within which Jesus lived, to fully understand just how revolutionary the ministry of Jesus Christ is and was, with emphasis on is and was. Now, I am not here with my own faith experience to cast an aspersion upon anyone else's faith experience. I understand that amongst us are those who share a Judeo-Christian religious point of view. There are others of us who believe in Islam, and I respect that point of view. There are others of us who believe in Judaism, and I respect that point of view. In America, I respect the point of view of agnostics and atheists. I do, as their representative, respect their point of view. But we live under a constitution. We do not live under the Bible. We do not live under the Torah. We do not live under the Quran. We live under a constitution. And in America, people ought to have rights, regardless of their race, their color, their religion. So we believe in equal protection under the law and equal justice for everyone in America. A text out of context, however, is still a pretext. What is the context of no trauma center in the South Suburbs? The trauma center issue and context is on the south side of Chicago, Mr. McNary. We have 3 people for every 1 job. And on the north side of Chicago, they have 3 jobs for every 1 person. There is an economic imbalance between north and south. I stood on the corner of 95th and Stony Island Avenue, thanking voters who voted for me in this past election. And I only had to stand on one side of the street. 95th and Stony Island Avenue coming north at 8 o'clock in the morning. At 5:30 in the morning is a traffic jam. Everybody leaving Park Forest and the South Suburbs on their way into Chicago to work. Trustee. I could stand on southbound Stony Island Avenue and couldn't get hit by nothing from 5:30 to 8:30 in the morning on every weekday because no one is fighting to get to work in Park Forest. No one is fighting to get to Harvey. No one is fighting to get to Markham. No one is fighting to get to Phoenix. No one is fighting to get to Dixmoor. No one is fighting to get to Dalton. No one is fighting to get to Olympia Fields, Homewood, Madison, Richton Parks, Chicago Heights. So the context within which we live and the context within which we enjoy a relatively sophisticated form of healthcare in the South Suburbs is wanting because we lack an economy on the south side of Chicago and South Suburbs that's growing like the economy on the north side of Chicago and northwest suburbs. And that's why I congratulated Mayor Ostenburg for his visionary leadership to create balanced economic growth. If we have balanced economic growth, then more people in the South Suburbs will be working as opposed to commuting in the South Suburbs. I have stood on every metro station, Commissioner Sims, from Richton Park all the way back into the city of Chicago in the 2nd Congressional District. And every morning from 5:30, I'm handing out why you should vote for Jesse Jr. flyers of everyone getting on a train. And maybe over the course of 6 months of campaigning, I handed out 4, maybe 8 flyers of people getting off of a train coming north-south to go to work. Everyone's heading north. 8 o'clock in the morning, if you're campaigning for anything, be working the northbound routes, not the southbound routes. Standing on 95th and Stony Island Avenue, the traffic is going north. No one's coming south. So, Mr. McNary, what do we do as South Suburban communities to reverse traffic? No, I want you to hear this, understand this. Because part of our healthcare problem is the reverse and the reverse commute of traffic in our region. And it's not just our healthcare problem. No one's coming out here to go to work. It means we pay more in taxes for businesses that are not here, and the burden is shifted to individual homeowners. That's why our property taxes are so high. It's ramifications for our schools. If Avis and Hertz and Dollar and FedEx and Hyatt and Hilton are not in the South Suburbs paying taxes, if we don't have a convention center on the South Suburbs or in the South Suburbs, if we can't attract a boat show and a car show and a hardware show and anything else that we need for people who come and visit us in the South Suburbs and leave their tax dollars here, we can't close the gap in health care. Even if the economy improves, we can't close it. And so I plead with you today to think about not only the need for a trauma center, but think about the context, Mr. McNary. Think about the economic context for which we struggle and for which we fight and for which we live. If we together fight for that context, I am confident that we can change things. And so as I prepare to yield back my time in conclusion, I look forward to hearing the discussion from your panel of experts and reactors as to whether the South Suburbs needs a new trauma center to serve the needs of this community. If not, what are we proposing instead? I'm going to be supportive of what you today conclude. I want to thank you for the invitation to Keynote. I'm going to leave a healthcare resolution with you to consider passing through your various organizations and in various capacities the need for a constitutional right to healthcare. We have to fight back at what the Supreme Court is going to do to Obamacare in a little less than 3 months. We need to fight back. And again, thank you for having me, and thank you for listening and considering my ideas.
Well, thank you, Congressman, for your outstanding leadership. We will now move into the next phase of our program. We're going to do 3 things. First of all, we will hear from a panel of 3 healthcare experts who will address the problem. Next, we're going to hear from a panel of 3 elected officials who will respond to the issues that are raised by the panel of experts. And lastly, And then most importantly, we will have audience questions and comments and observations for any of the speakers that you've heard here today. And I guarantee you that we'll be out of here by 10 o'clock tonight. Their comments. There's no penalty for ending early. The next group of panelists will take 5 minutes apiece. And then lastly, we'll have 15 minutes for questions. That's 15, 15, and 15. So first, let me introduce our panel of experts. Dr. Raju is the new CEO for the Cook County Health and Hospital Systems in Chicago. Prior to accepting that post, Dr. Raju served as the Executive Vice President for the Medical and Professional Affairs in New York. He served as the Chief Medical Officer of Coney Island Hospital. And he graduated from the University of the Madras Medical College. He entered that at age 16. He is now married, a fellow resident, He met at Madras. And they have a son and a daughter. They live in Chicago South. Ladies and gentlemen, our first panelist is Dr. Raju. Our second panelist, you've heard her name more than once tonight, and so you'll hear it again. Her name is Jennifer Artis. She's the Director of Public Affairs for the St. James Hospital and Health Center located in Chicago Heights and Olympia Field. She has a 30-year-plus history of healthcare administration and advocacy. She started when she was a little bitty baby. Deputy Chief Bruce Ziegel has been a member of the Park Forest Fire Department since 1977, started as a member of the Paid On-Call Division and rising through the ranks of the Career Division to his current position as Deputy Chief. Ladies and gentlemen, welcome Deputy Chief Bruce Ziegel. They each have 5 minutes apiece, and we're going to start with Dr. Raju.
Thank you, Mr. McNary, and it's such an inspiring speech, Congressman. So it's really, you articulate a lot of the principles for which we stand for as healthcare professionals. And I always believe that healthcare is not only a fundamental right, I think it's a human right, and it's a civil right, in my opinion. And some of us who really figured out that the healthcare reform did not go all the way to address the healthcare needs of all the other folks who are still being uninsured and uninsured under the newer plan. But again, I'm grateful because that is a great plan. It really gives us a tremendous amount of impetus to our patients to get a better health care. And we are very happy to be on the second anniversary of it, and I want to really go forward with it. Just want to first thank Mayor Ostenburg for giving an opportunity to be here, and I want to thank my panelists for being here. And the community's need for trauma center is extremely vital, and the discussions is extremely timely at this point. Congress are very eloquent discussing the issues, and I, as a new member of the community, I truly understand and see that it's my responsibility is not only take care of the sick people in the great county of Cook, but also health. We are also responsible for the health status of the Cook County residents. During my short time here, I come to appreciate the health needs of southern suburbs. That is absolutely apparent that there are unmet health needs in this community. One of them is trauma care. Injury is a common cause of death among ages of 1 to 34, a leading cause of disability, and a major contributor to the health cost in this country. World Health Organization suggests that 1 in 10 deaths worldwide is a result of injury. In my past, I was a trauma surgeon, and I have been a founder and director of a level 1 trauma center in Brooklyn, New York. I'm well versed with and very much involved in my career, both analyzing the need for trauma care in the community and planning for it. I'm also aware there are multiple efforts have been undertaken in the past on this issue, and it resulted in a study which was funded through the Cook County Department of Public Health and the group chaired by Lee Friedman of University of Illinois, Chicago. The study, which included a careful analysis, did not find any adverse mortality issues, but suggested some very important recommendations we need to implement to improve trauma care in southern suburbs. This study concluded there were no immediate adverse effects, and that Christ Hospital picked up the majority of seriously injured patients that has been transferred to St. James Olympia Fields. The project team had the following recommendations to improve and safeguard the regional trauma system in southern Cook County. Number one recommendation was create a centralized ambulance service in southern Cook County. The second recommendation is develop pathways to facilitate and coordinate and planning between hospitals with specialized trauma units independent of trauma region. The third recommendation was create a system in Illinois to designate hospitals as level 3 and level 4 trauma centers. Number 4, continue active surveillance of the long-term impact of the closure of St. James Olympia Field Trauma Center. As an experienced trauma director, and I have some experience in the past in evaluating trauma care for communities, let me draw some distinction between the trauma center and the need for trauma care. Across the nation, there are excellent trauma care is being delivered by many non-trauma centers, and the need for emergency care is more important to save lives in our community. A well-functioning emergency department with the essential trauma elements like orthopedic surgery, neurosurgery, and intensive care is be very effective to replace a level 1 trauma center in a community. We need to understand also the trauma center is only effective in less than 30% of trauma deaths in this country. To understand the concept, I just have introduced a well-known concept which most of you are aware of. It's called the trimodal pattern of death in trauma. Most trauma deaths occur in the first hour of injury. Most of the time, they are often before the patients are brought to the hospital. This is what we call a DOAs. It accounts for 50% of trauma in this country. And the death is usually because of very severe brain injury on our major blood vessel which is ruptured in the field. Such death can only be reduced with preventive strategies in community. That is, like a ceasefire is an example of that, right? Drunk driving regulations are an example of that, so people are disciplined so not to produce a trauma, because 50% of people will die of trauma before they even go to trauma center. The second peak of death occurs between 1 to 4 hours after injury, and it accounts for 30% of the trauma death in this country. These are preventable, and appropriate early diagnosis and treatment of some of the life-threatening injuries will save the patients. This period during which lives can be saved by efficient treatment, usually in trauma center, is called the golden hour of trauma. Then the third death occurs weeks and days after the initial trauma, and this is due to infection or multiple organs failing as a result of trauma. This accounts for 20% of the death in this country. Though trauma care is important in the South Suburbs, we should not forget the other silent killers in our community. Though this conference about trauma, let me address some of the healthcare disparities that exist in South Suburbs as a whole. We cannot, as leaders, address one element of healthcare and ignore the other elements that create widespread healthcare disparities in our community. As we move through a thoughtful decision process, we need to address all the healthcare issues that plague our community today. My only plea is that as we debate the trauma need for the community, let us not forget the silent killers of this community, like heart disease, diabetes, and stroke. As we consider an advocate for trauma center, let's not forget other pressing needs of the healthcare in this community. Cook County, and the heart attack mortality rate is 80% higher for African Americans in southern Cook County, and is more than 40% higher than African Americans in the United States. Heart attack rates are much higher in the southern community, in the South community, than for all ethnic groups. Females in southern Cook County have the highest heart rate mortality rates compared to any other region. Southern Cook County is disproportionately high stroke rate in African Americans and was more than double than the rate for the whites. The cancer rate in Cook County, of the southern Cook County, is high, especially among African American population, and the rate of death from lung cancer is much higher compared to anywhere in this country. The southern Cook County diabetes among African Americans is also much higher than the African American population in the state of Illinois. Low birth weight and the inadequate prenatal care complete the bleak picture of the need of a robust healthcare strategic plan for the southern suburbs. Now the question is, how do we tackle these healthcare disparities, which are so apparent in South Side? I would submit that the responsibility of discussing and charting how the healthcare system, both public and private, can serve our community better is a responsibility of all of us. The private and public hospital systems, the advocacy group, our elected leaders, our community organizations, our faith-based groups. We need to come to the table to draft a comprehensive healthcare policy for the southern suburb that will serve our communities well. In the post-healthcare reform world, where we finally start incentivizing for the healthcare, as opposed to giving money for sick care, that's what we did for the last 40 years in our country. New avenues are open for all healthcare workers to collaborate and cooperate with each other and not compete with each other as we did in the past. It is no more about marketing strategy, it is all about population health. Forums like this raise consciousness of the people, plan for the healthcare needs in the community, and hold the healthcare leaders like me accountable. If you all keep the patients first in our decision making, we will build a healthcare system that will leave no one behind. We will create a healthcare system that will address and correct the healthcare disparities that exist today in our community. We will foster a healthcare environment which will think of community needs rather than profitability of the market. So thank you very much for this opportunity, and I'll be waiting to listen to my co-panelists.
Thank you, Dr. Raju.
Good afternoon. And Mayor Ostenburg, thank you very much. I think. And Congressman Jackson, thank you. You've heard a lot of statistics about the trauma center, and one of our biggest advocates is Commissioner Sims and Apostle Carl White. They've been leading this charge ever since St. James announced that it was closing the trauma center. But not only does it take money, it's about $10 million to run a trauma center every year. $10 million. But our major problem, as the Congressman has indicated, and that's why I did what I did for him, is economics. We don't have enough doctors coming out to the southern suburbs to staff. They didn't want to come out to take care of us because they were going north. They live north. They spend their money north. What we face is truly a problem of health and the right to quality health care. Do we need a trauma center? With the rate things are changing, possibly. Whether it be a level 1, level 2, level 3, I am not the expert. However, we do need a system of care, and right now we don't have that. And anyone here who's gone through our healthcare system can attest to how difficult it is to even go and get a continuity of care. I think we are fighting one of the greatest fights of our lives, because if we let Obamacare slide or House Bill 30, we're in trouble. And it breaks my heart that we do not have enough people coming out to fight for the right to health and understand that it is an economic issue. About 2 years ago, I had a young man who was 19 years old, and he was wandering around the hospital. And someone said they thought that he was homeless. And it wasn't that he was homeless, it was that he was attempting to get service because he had a hernia. And nobody would take care of it. He couldn't go to work because he was in such extreme pain. So St. James did what they could. And then, but he needed surgery. So they said, go down to Cook County. He had no transportation. These are real stories of people in our community who don't have the opportunity to enter into a system. And so eventually, what I was able to do for him was to set him up, and Northwestern, bless their little hearts, decided that they would take him because the surgery was extremely expensive and the aftercare was even more expensive. And so with St. James, we got enough money to be able to send him to North Carolina where his mom was so that they could help him. That's just one story. Trauma is about being in a major accident, but what about the everyday? As I said, I thank you, Ostenburg, because it gives me a pedestal to talk on about the everyday health disparities in our community, as well as the fact that one of the things I loved about Congressman Jackson when I asked, well, why should I stomp the ground for you, is that he said, look at our children. Where do they have to play? That's a part of health. Part of health is having our kids have a playground. My grandkids are here this weekend with me, and the only place I could really take them was to the mall, where I paid $7 for them to jump up and down in balls. This is health. And it's also economics. It always goes back to the economics of our system. And we need to understand, I don't need to constantly re-quote what he said about our health disparities. The number of us who will die, not because there's not a trauma center, but because our economics is such that we don't have the money to be able to get in to get the best care that is possible. Because some people don't feel that it is a right to have health care. And that's me. Thank you.
Thank you. Mr. Mayor, Representative Jackson, distinguished panelists, I'm here to talk about the impact of a lack of a trauma center on the South Suburbs, both economically and socially. You must understand that, as the doctor spoke about, we're under a system called the Golden Hour, or more importantly, the Platinum 10. The Golden Hour says the patient needs to be at the hospital getting definitive medical care in less than 60 minutes. The Platinum 10 from the emergency medical aspect, which I've been in for 35 years, is that that patient must be on the way to the hospital in 10 minutes from the arrival of the paramedics on the scene, preferably 10 minutes from the time of the trauma. That is a difficult problem, as time is both simple and complex when it refers to a trauma patient. Simply put, for the trauma patient, time is survivability. The faster they're in an emergency room, the better their chance of survivability. From the downside, it's not a simple prospect to get them in such a quick time. First off, the trauma has to be discovered. Someone has to see the accident, find the victim, recognize the problem. Then they have to call 911. Generally anymore, that's from a cell phone. Unfortunately, cell phones don't give you an exact location nor pinpoint the person who's making the telephone call. So sometimes those calls bounce around from dispatch center to dispatch center. A recent trauma patient we took care of in Park Forest, their trauma call went through 3 fire departments before it was received by our fire department, who was less than 4 minutes away from this patient. But because of that delay, it was over 10 minutes until we received the call on that patient. After they receive the call, there's a simple call handling time. Thankfully, this only takes about a minute for the dispatcher dispatching. And then the paramedics have 4 to 6 minutes to arrive on the scene. As you can tell already, that Platinum 10 is almost already gone before we even get on the scene. From that point, we may have to extricate the patient. Have they been in a car accident? This could take up to 30 to 45 minutes with the new car construction that's out there in the field right now. After that, we need to transport this patient rapidly to the hospital, secure them to our stretcher, get them in our ambulance, and make our way directly to the hospital. Our standard operating guides, put down by our project medical director, say, in a trauma case, unless it's not going to delay treatment and transport of the patient, we are not even to perform IVs or any advanced life support. We're to do basic life support, pick up this patient, and make our way as quickly as possible as we can to the nearest hospital. Unfortunately, because we don't have a local trauma center. So you can see how the Golden Hour and the Platinum 10 severely affect the impact of the paramedic in performing their job. The other thing that happens is, from a social and economic aspect, this transport, we're going to go to a trauma center, which is at least 30 minutes away, lights and siren from our location, we're going to have to spend an inordinate amount of time at that hospital. First, we have to transfer care of the patient, then we have to perform our paperwork, we have to get resupplied in a hospital we're not familiar with the system, and then we need to return to our community. We don't get to return lights and siren. So that half-hour drive to the hospital now becomes 45 minutes to an hour for us to get back to our community. So now our community's been deprived of our services for more than an hour and a half to 2 hours possibly in severe trauma case. Right now, the average trauma case, our paramedics will be out of service for approximately an hour from the time the tone goes off until they're back in service on the edge of our community. So we have all these problems facing the paramedics in providing the service to their community. It's both social and economic. Because we have these issues, multiple ambulance calls occur, more paramedics are needed, more services are required. Most communities can't afford these services to an infinite degree, so what do? They rely on their neighbors. We call Madison, we call Richmond Park, we call University Park for assistance, and vice versa. You have to understand that most people say, well, then they can call helicopters and bring those out. In most cases, our paramedics can be at a hospital in the time it takes a helicopter to even get off the ground. We had a recent case, Super Bowl a few years ago, where unfortunately a grandmother traveling southbound on Western Avenue with her granddaughter in the vehicle, unfortunately not in a seatbelt, was struck head-on by a drunk driver. This child received a severe head injury. Upon our arrival, our paramedics were saved the time of extrication as someone handed them this young girl at the scene. But unfortunately, they couldn't leave right away. They still had the grandmother and the drunk driver that needed some attention at that point in time. We called in additional ambulances. We got into discussion with the hospital. The doctor insisted he wanted to send a helicopter out to our scene to get this young lady out of our scene. I said, well, doctor, as soon as another ambulance arrives, my ambulance will be at your facility before that helicopter can get off the ground, even if it can fly. Another problem with helicopters, you can't fly 365 days a year, 24 hours a day. So in conclusion, what you have is time, both simple and complex, is the challenge facing the paramedics. This time, it reduces the chance of survival for the patient. That's a tragedy in itself. But the social and economic impact on the community and the time it takes to handle this trauma patient to go to a long-distance trauma center is also a time we can't afford. Thank you.
Give these three outstanding public service a round of applause. But right now we're going to bring up the next set of panelists, the elected officials, who will comment on what they've heard. And again, after then we will have the questions, comments, and observations from the audience. Our first elected official has served in the Illinois House of Representatives since 2009. Prior to that, he has served as the mayor of Chicago Heights. And prior to that, he served as the president of Bloom Township High School District 206 Board of Education. He's a Teamster and a graduate of Homewood Flossmoor High School. Ladies and gentlemen, homegrown, and we're proud of him, Representative Anthony DeLuca. They issue license plates in the Illinois General Assembly based on seniority. Her license plate number is 3. That means that only 2 others have served longer in the Illinois General Assembly. She was first elected in 1985, and I know of none who fights harder, who fights more passionately, and fights more effectively for the people of Illinois than the chairperson of the House Healthcare and Availability and Access Committee, State Representative Mary Flowers. Since 1994, she has represented the South Chicago and South Suburban 5th District. She is truly an aggressive, progressive advocate for her community. I know of no better fighter than the people in this community. I'm just glad she is on our side. Commissioner Deborah Sims. And they each have 5 minutes apiece. We're going to start with Representative DeLuca.
Hello.
Hi everyone, how you doing today? Good to see you here. I'm happy to be here. Thank you for the invite. And a couple quick observations. At the beginning, Mr. McNary had mentioned that on a Sunday afternoon when it's 65 and sunny, there is no other place that he would rather be. Now, if anyone in the audience has the passion for golf the way I do, I could possibly think of another location, but I'm happy to be here. And the other observation is this is the second time I'm breaking a rule of mine. This is in about 6 months, the second time I'm breaking my rule. And I never speak at an event where Congressman Jackson is speaking at. Congressman, that's the reason why. Very nice remarks. Very well done. Okay, so we're supposed to react. Well, I did a little preemption work and I talked to some people at St. James Hospital and I asked some questions. I wanted to read the question that I had and the answer, and then a couple of comments from today. How will discontinuing level 1 trauma care at St. James impact emergency services in the community? Very, very minimally. 98.5% of the emergency cases do not require trauma services. In fact, the discontinuation of level 1 trauma services will not affect the vast majority of the local community. All patients needing emergency care will still be treated by St. James' 2 comprehensive emergency departments. Those patients with the types of injuries who require trauma services are brought to St. James, will first be stabilized, and then transported to other trauma centers in the area. And I'll have a little bit more to say about that. How many patients will be impacted by the change? Approximately 71,000 patients visit the St. James emergency rooms, and about 1,000 of those were designated as level 1 or level 2 trauma cases. So for over 98% of the emergency room patients, they will have the same full service and quality emergency care. Will my family still be able to go to St. James Hospital emergency room? Absolutely. Both of the emergency room departments in Chicago Heights and Olympia Fields will still provide the emergency patients the full range of care. We will always have the 70,000 plus patients annually who do not require that trauma service. Now, one of the things that was brought up today about that golden hour of trauma for life-threatening injuries, that 1 to 4 hour time period, that is certainly where I see this becoming the major concern. Because if I think about one of my own children, and if my child was injured severely and required this care, how would I feel about that child going and just being stabilized and basically bandaged up before they go to another location, which I think it was stated 30 minutes with lights to get there, and then treated. I think that's what is really the crust of what we're trying to determine today. That seems to be the biggest issue right there, is in those cases where you require that trauma service and that delayed time to receive that service, how will that affect that patient? The cost is $10 million. Is that for both campuses? $10 million. So we certainly have the issue of high cost and the issue where the doctors would rather be elsewhere. That would be something that would have to be overcome. And, the economics of it, Congressman Jackson spoke about it so well, and the economics of it in our area, it's just why when I was mayor and as state representative, some of the projects that are unpopular to some people, I've continued to support mainly for the purpose of economics. Anything that would infuse some kind of economic action in the Southland, create employment opportunities, create tax revenues that we need so dearly, such as the airport. And did you mention the airport today? I did not. I got it by accident, Congressman. A Southland Casino and the Southeast Service Line. You know, 3 projects that we've been discussing in the General Assembly. I see my colleague here, Al Riley. Good to see you, Al. And those are projects that many of us in the Southland, I think all the legislators in the Southland, support for that reason. And one last thing I'll touch on, and I'll pass this along, is, you know, we talked about the difficulty of our business in this region, in the Southland, our economic viability, 3 people for every 1 job, up north, 3 jobs for every 1 person. Well, a lot of that has to do with our tax policy. A lot of that has to do with our tax policy and how it affects our businesses in the Southland. You know, we're competing with other markets. We're competing with other counties. And until it's reformed, we're not going to see any dramatic change here in the Southland on attracting new businesses. We continue to slowly see more businesses closing than opening. Thank you very much.
Thank you, Representative DeLuca. Representative Flowers.
Good afternoon, everyone. And I would like to take this opportunity to thank the mayor for inviting me. It's been a long time since he and I had the pleasure of talking, but we did serve together in the Illinois House of Representatives. And always a pleasure to see the young Congressman Jesse Lewis Jackson Jr. I've had the pleasure of marching and fighting with his dad for so long, and it's just good to see that apples don't fall too far from the trees. You're doing a fantastic job, and we're very proud of you, young man. As I was driving out here, leaving the southwest side of the city of Chicago, I felt like I was kind of driving out to heaven because the grass is greener, the roads are smoother, and I did see quite a few businesses. But more importantly, I'm always at awe because for 28 of the best years of my life, I've had to travel the South Suburbs one way or the other. Going back and forth to my job. And I often wondered what would happen if there was a major accident on I-5, I-7, I-80, whereas that one hospital can't handle it. And it's one thing to talk about somebody else's job, it's another thing to talk about mine. And so I'm reminded of what Martin Luther King said, if I may just paraphrase just a little bit, that the worst form of inequality is injustice in healthcare. The worst form of inequality is injustice in healthcare. And when I think about the south side of the city of Chicago, which I came from, to come out here today, I was living in a food desert. I'm still living in an access to healthcare desert. It's enough to kill you. And that is exactly what's going on. When you talk about $10 million for a trauma center, you're talking about something that is needed for not just a certain group of people, but for human beings. So I don't know how much your life is worth, yours, but there's no amount of money that could compensate for the loss of what a few minutes, instead of it taking 30 minutes to get to the trauma center or to get to a hospital. Because let me just say this, for those of you who think that hospitals are always staffed by doctors, they are, but they're on call. They are not on the premise. So if there's an accident, you're going to have to wait until the doctor leaves the golf course to try to get to the hospital. Hopefully there's not traffic. So when you take into consideration, I'm the chairman of the healthcare committee, and I remember my first fight, I was kind of really upset with the speaker when he asked me to take on this committee, because I thought, who would ever fight me over health care? I had some other issues I wanted to deal with. Number one being DCFS. And, but then I found out that there were business people, insurance companies, that had conflicts of interest. And they were telling doctors what to do. They were putting gag orders over doctors, telling them that they cannot tell you that you have cancer, because if they told you, they have to treat you. Truly violating their Hippocratic oath to do no harm. Truly not even I'm reminded of Linda Plano, who testified before Congressman Jackson, that she caused the death of thousands of people, and never once has she been held accountable because of the dollar. Because of the dollar. So when I think about what the commissioner stated in regards to her grandchildren not being able to go outside to play, when I think about the community that I left today, coming out here, I was reminded of how many people are suffering from diabetes because they do not have access to health care. I'm reminded of so many children who will die because of the food that the schools are feeding them and the lack of exercise that they're being given. When studies have been proven that the more exercise a child gets early in the day, what happens? Oh my God, do you know what happened when a child had exercise? Grades go up and crime goes down. Now we can't have that now, can we? But if we don't have it, we will have children living longer and sicker, and that will exceed the $10 million to the taxpayers, because either way it goes, we're going to pay for it now or we're going to pay for it later. And doctor, you are 100% correct. We have been dealing with patients, or we have had a delivery of care that dealt with sick people. Well, how about paying people not to get sick? How about the proper foods, the proper exercise, the proper diet, education, things that can prevent you from getting sick in the first place, that won't cost you a long time. But to know that you're being delayed and denied access to care, and doctor, and any of you that work in the hospital, the longer it takes for you to get there, because those insurance companies or those gatekeepers lost the referral, despite the fact you're paying for the insurance. People really want to say to you, they have you think that you're getting something free. You're not getting nothing for free. You're paying for it one way or the other. So we have to begin to take back the discussion. You're absolutely right, Commissioner. There is not a continuity of care, and we lack a healthcare system in this country.
Yes.
We lack a healthcare system. And this year, and today, last week, we had a big fight in regards to Medicaid. Now, they think that we're going to cut Medicaid to the people, we're going to cut the healthcare services to the people, but allow the vendors to still provide them with $1 million contracts. That is not going to happen. Early part of this year, do you know we denied babies access to Medicaid? This is America. We, the state of Illinois, disallowed babies access to health care. And thank God the federal government came in and stopped us and said, we told you, you cannot make, because of the Affordable Care Act, you cannot make any changes. If the law was not in place and children were not denied in 2010 or 2009, I believe it is, you cannot make these changes now. And so, and when you talk about applaud the president, what he did in regards to health care, because the most important thing he did in regards to pre-existing conditions, and to know that the insurance companies can no longer delay or deny you or discriminate against you because you have a pre-existing condition. But that's the reason why no child, no infant being born last year would have gotten access to health care, because the insurance company said, rather than to give you care, we will not insure anyone. Enough is enough, ladies and gentlemen. It's time for us to put on our marching shoes, have a level of insult, because today it's somebody else's time.
Thank you. Mayor Ostenburg, Bill McNary, and to all of the panelists and everyone here today, the Congressman. I'm glad everyone's here. This room should be filled with people. This is a very important charge for the people in the Southland. I took on this challenge kicking and screaming, because this is not what I wanted to do as an elected official. Apostle Carl White, Celine, Muirden, Carl White, Jennifer Artis, sat me down and said, this is something you must take on. This isn't something I wanted to take on. And they told me there was no way that I could get around doing this because this was the best thing that I could do for the people in my district. So today, I thank all of you for making me take up this challenge. This forum is a good forum, but this is the first forum that has taken place. In my office, in 2009, November 13, 2009, I had a meeting with the stakeholders in this. And at that meeting, it was Commissioner Murphy, and I wish she could have been here today to give some input. On the panel that day was Michael Holmes from St. James Hospital, James Doherty, MD from Advocate Christ, and I thought that was a great thing. That day we got Advocate Christ to come to us. Vincent Pryor of Ingalls, Bill Foley, who was our past CEO of the hospital, and Enrique Beckman at Metro South. We have that in our office. And if anybody would like a copy of this, we can get that to you. But our mission that day was to talk about the trauma center. Al Riley has always been a champion as well, and so has Will Davis. And I'm surprised Will is not here, but we all know Will has a baby, so he's probably at home taking care of the baby. But all of us in the Southland have taken up this challenge because it's important. When Jennifer came to me and I said, Jennifer, we have no trauma center in the South Suburbs. And she said, no, we don't. And there's no money. So I'm figuring, well, why can't the county take up the trauma center? So we put the wheels in motions to put all of this in place to have everybody there to talk about a trauma center. One of the reasons why this is really important to me, I don't know whether any of you recall Bishop Jordan. Bishop Jordan, from my understanding, went to St. James Hospital and was not a trauma center. His trauma was not blunt trauma, but it was trauma that St. James could not handle because they were no longer a trauma center. So they had to get him to a hospital, I believe in Joliet or Indiana. And by the time he got there, he expired. That isn't the only story that I heard in our mission in trying to figure out where we get a trauma center and how we get a trauma center. I was at a Union Hall meeting for labor, and there was a gentleman that came up to me and he said, Commissioner Sams, keep up this fight. He said, my wife had a heart attack, and we needed a trauma center to get to real quick. And he said, we went to St. James, and St. James was not a trauma center of the traumas that his wife needed. They had to try to get her to Christ. And I don't have to tell you what happened. She passed. So this is serious when Representative Flower talks about it's somebody else. It could be you tomorrow. You could be traveling along 5780. And God forbid that there's a train. My chief of staff picked me up, and the reason why I'm late, he said, I got caught by a train. I was thinking about this as I was coming here. What if there had been an accident? And I had to get to Christ. And we had to stop at that train. Or God forbid that Christ was on bypass. And I had to get to Stroger. And we're talking about a matter of minutes because we don't know what the trauma could be. It could have been a gunshot. Well, by the time I possibly could have gotten to Stroger, guess what? I may not be sitting here with you today. It doesn't have to be me. It could be you, your mother, your father, your children. And all of us that are in that golden age, we all love our grandchildren. And God forbid one of them would be outside playing. And there would be there's a gunshot or hit in the head with a baseball bat. and you had to get on 57, and the traffic was heavy, and you had to get to Christ. And when we had that meeting, the trauma center, Channel 7 went out to Christ, and at that meeting, Christ told us, we're very rarely on bypass. Channel 7 went out to Christ, and guess what? It was so many people in their waiting room, they were on bypass. So God forbid that this could have happened, and that child had to get to Christ, and they were on bypass, or you had to get to Stroger. They say it takes 4, and I beg to differ with everyone that tells us it only takes from the South Suburbs to get to Christ is 30 minutes. I don't buy that. I don't buy that it takes 45 minutes to get to Stroger from the South Suburbs. I believe it takes longer than that.
Can I ask you what bypass is exactly?
Bypass means the hospital is not taking any trauma patients, which means if the ambulance calls the hospital and says we're bringing the patient that has a gunshot, and the hospital says our emergency room is filled up, we don't have the doctors to service that patient, that means that ambulance has to regroup and try to get you to the next trauma center. Well, we all know in the Southland there is no other trauma center. So the next place for you to go is either Indiana, or if you're in the driving, excuse my language, drive like hell to get you to Stroger. So this is an important issue for all of us. And Congressman, I'm so happy to see that, because all of us have been working on this, that you are also going to take up this charge to help get a trauma center, because I think your voice will carry a lot more weight than the weight we've been trying to carry. And we're happy that you're going to help us take on some of this heavy lifting, because so far our voice, and as eloquent as you speak, I know you can talk somebody out of $10 million. And I'm going to tell you, and as good as you speak, I know you can talk more than 10 million. So I'm happy to see that you're going to take this on to help us, and we don't expect you to carry all of this weight. As we talked about a village, it's going to take this whole village to get that trauma center and to do what we need to do. The one thing that you said, and you said this early on, health care is a right. And the people in the South Suburbs pay taxes. Not only in the South Suburbs, South Suburbs pay taxes. We have a right to a trauma center. We have a right to health care. We have a right to adequate health care. I'm happy to see everybody here. I'm happy to see all my colleagues here, and that we're all taking this up. And this is a fight that we're not, and a bill, we know that you're going to be standing on the lines with us fighting. We know that you bring a whole lot of people with you when you come. So we're happy to see that you're here. And we're not done. And we're not going to stop until we see a trauma center.
Thank you, Commissioner. You all, this time we just hold our seats and let people ask questions. Cornell West, by the way, said you can't lead people if you don't love people, and you can't save people if you don't serve people. So for the depths of the love that they have for their people and their commitment to public service, will you please give Representative DeLuca, Representative Flowers, Commissioner Sims, and Representative Al Riley, stand up, Al, and give them a round of applause. Park is here as well. Will the Mayor of University Park please stand? Let's keep speaking. President Preckwinkle appointed a Southland Healthcare Advisory Commission, and that is led by Apostle White. So Apostle White and all of the members of the Southland Healthcare Advisory Committee, please stand and be recognized right now. So now it's your turn. Democracy is a verb, not a noun. So we are ready for questions and comments and observations, and someone who is very shy, we have to coax him to come up. The head of the, Salim Al-Nuridin, the head of the Healthcare Consortium. Come on, why don't you come up so we can hear you, brother? I want to put a mic out there.
Thank you very much. First of all, let me really thank the mayor because I was sitting up front, but I don't think this is a sparse room. I think this room looks real good to me. I'm really happy about it because when we think about that process of, the snowball, we growing. When we had the meeting, I wasn't even at the meeting. I had to be on the phone to listen to it. So when the guy from Christ said, we can handle all the trauma out here, and we already had the numbers on how many times they go on bypass. I would just like to thank the congressman and everybody who spoke, because everything just is coming together. I could be more hopeful, Apostle, than I am today. The Southland has been suffering for the lack of a collective vision, so we couldn't move collectively. So being here in Park Forest and realizing, and I'm glad you can name all of them by heart. That shows you a good representative, because I get fumbled up trying to remember all those villages and townships and things that we have. But collectively, the vision for the South Side is what is important, and that vision has to include everything that you said. But my comment about the mayor's opening statement, we want to leave here today with a plan. I think it's imperative that we don't give up on the need for a trauma center. No way. And no way that anything that anybody could say, no numbers that could be utilized, could tell us or justify the fact that we know we need a trauma center in the immediate area. But I beg you to listen to what Jennifer Artis said, and I think also what a couple other panelists said. What we don't have is a system. I think we need to, if we're going to build a regional healthcare delivery system, at the foundation of it, we may talk about the clinics and the ambulatory system and the hospitals for prenatal care, and naturally we try to do something in Park Forest around all of that. But immediately when you go into the emergency room, first thing they do is stop the bleeding. What we need is something that's going to stop the bleeding, Congressman. We need a trauma system. We need you, we need our state representatives, we need our county representatives, because none of these hospitals are going to stand together and put together a system unless you are there and refusing to benefit them, unless they sit down and set up a system. None of these doctors are going to just willingly say, oh yeah, we're going to be on 24-hour call, we're going to put together a system, we're going to make sure your patients come back to you if that's where they came from in the first place. We know what the system needs to be. We need a trauma system in place immediately while we continue to fight during these hard times to get a trauma center. I'd love for anybody to comment on this.
Thank you so much.
When Salim talks about a trauma, what do you call it, Salim? A system. When he talks about the system, when we had the discussion in regards to why the doctors don't come, why we don't have a system is because we can't afford to pay the doctors. And we don't think that we're doing enough to maybe attract those doctors. Because if you recall, back in the old days, the doctors came out of the community. Where are the doctors? And I'm quite sure if we did, and Congressman, you're good at doing, your office is good at statistics. If we could find out how many doctors actually commute, maybe from out south going to those other hospitals, I'm willing to bet you will find that a lot of doctors do live in the South Suburbs. And probably, if we knew who they were, we could have some incentives to make them work as a trauma center in the South Suburbs.
Congressman to respond.
I don't know if I want to respond as much as ask a question. And I want to distinguish, and I'm not trying to be overly technical here, between the need for trauma care system and who we may end up in terms of our solutions pointing the fingers at. If it's doctors who are leaving the area, what are the incentives that coax them to stay in the area? That's a theory. When this Supreme Court decision, let me back up. First, there's Brown versus the Board of Education. First of all, there's Rosa Parks. There's Brown versus the Board of Education. Then there's Rosa Parks. Then a civil rights movement begins, which equals the 1964 Civil Rights Act, and then a Voting Rights Act of 65. And that's the process. That's the American process. Soon there will be a Supreme Court decision on the President's health care initiative, the Affordable Care Act. My own opinion is shortly after that decision, whatever its outcome is, the lawyers of our various hospitals, the lawyers of our various healthcare organizations, we ought to come together and file our first lawsuit on the basis of disparate treatment, inadequate health care, the lack of a trauma center, or whatever it is, claiming that care is being disproportionately delivered to our constituents in the legal process. Now that requires, not finger pointing, but it requires the lawyers from Advocate, the lawyers from St. James, people who are already paying lawyers. Some of them ain't doing nothing, some of them real busy, but coming together as a legal community. Now, where are the stories? Where are the stories that back up such a lawsuit? The stories are the stories that each of you have already shared with us. Ms. Artis shared with us, that the doctor shared with us, that other panelists have shared with us. The Willie Jordan story is a story that ought to be part of the lawsuit. Those of us who lost loved ones because of heart attacks ought to be part of the lawsuit. In other words, there ought to be a comprehensive lawsuit from our region on the basis of whatever the Supreme Court decision says. Just as Congress passed an act that led 13 states and now 20 states to file a lawsuit against what the president does. Whatever healthcare system we are left with after the court, before you arrive, Apostle White, Reverend Kreider, congratulations to both of you for your outstanding leadership and work in this area. Tomorrow, the federal court is going to hear the case against the president's healthcare initiative. It begins tomorrow. And then by June, probably before the election, maybe October, a decision will come down, and that will be the new healthcare law of America. Not the act that Congress passed, but what the court is going to decide in October. Well, shortly thereafter, we already know where they're going. Shortly thereafter, we ought to be filing a major lawsuit paid for by our various healthcare initiatives about the absence of a trauma center, with the examples of the lives that have been lost because we have to go to Stroger, because we have to go to Indiana, because we have to. And that be the basis of the context for which we are moving forward. Now here's my question, Mr. McNary, and forgive my ignorance. Who is responsible for assigning level 1 trauma? I know St. James had level 1 trauma, and they would be, I'm not going to beat up on them, they would be closed today if they had to keep paying $10 million a year to keep their trauma center open. So they made a judgment, not on the basis of people's lives, but on the basis of whether or not they can stay in business. So this isn't about them per se. But who assigns level 1, level 2, level 3 trauma units to hospitals and to communities? Because it seems to us that they should be a target, Mr. McNary, of such a lawsuit. Is it the county that assigns level 1 trauma, that distributes them across the state? Is it the federal government? Then we're suing the state of Illinois. This is a federal action against the state of Illinois on the basis of where it assigns trauma units. Why did 10 trauma units here and none here, and 5 up here and none here? That's the basis, with the evidence of Reverend Pastor Bishop Willie Jordan, the evidence of all of these people who are, and now we're in the context of a legal process that forces us to say the state of Illinois now, as a result of the verdict of this lawsuit, must now fund, I don't care how broke it is, it must now fund a level 1 trauma center in the South Suburbs on the basis of the legal action. That just, for me at least, seems the initial logical step. And of course, the burden that falls on Representative Flowers, Representative DeLuca, Representative Riley, and myself to make sure that such a designation is funded.
Let me have Dr. Raju respond to the technical question, then I'll bring up Apostle White to respond.
Thank you, Congressman. Yeah. I think the trauma center designation is usually given by the State Department of Public Health. But it is bigger than that. What Salim was talking about is we do not have a healthcare system in this country. So when we talk about trauma, that's what I'm trying to emphasize. Just don't look at trauma center. It's a trauma system and healthcare system. You need all of them as a part of it. The reason we never had that for so many years because we never funded the right healthcare. As I said before, we funded sick care. If you make people more sick, you got more money. If you keep people healthier, you didn't get money. And I always used to say this because I've been in healthcare practice for 33 years. If you have a emphysema asthma, you come to the emergency room and they do good treatment. They send you home, they get $100. They admit you to the hospital, they get $4,000. They admit you to ICU, they get $15,000. And they put you in the respirator, you get more dollars. So this is a system which basically made it into a sick care system. It is purely doctor-centric, right? And it is purely based on medical education. It is all thought about how to train the doctors, how to do it. That's one of the problems why there's a migration of everybody going to these big-time academic medical centers where they feel that they are going to get that because that is where all those things come in. So this is an important aspect of it. I'm so happy and energized to be here at this point of my life because under Accountable Care Act, finally we got an opportunity to change the healthcare system and do it the right way. If you don't do the right way, we will miss it forever. We will never get this done anytime. So this is the greatest opportunity for us to create a healthcare system, a trauma system, which is patient-centric. It is based on coordinated care. Everybody talks to each other. Not based on purely money, profitability. Because the reason we got into trouble because we always competed with each other all along. If I run a hospital, I compete with the hospital across the street. I say, okay, you have a 32-slice CAT scan, I'm going to put a 64-slice CAT scan. Right? You have an MRI, I'm going to put a bigger MRI. So you have neurosurgery, I'm going to do more of those things. Because I want to take your patients away from you. But this ACA, Accountable Care Act, the first time will ask us to collaborate and cooperate, not compete with each other. So this is the greatest opportunity. I think probably we'll be able to do this right this time. I really, really pray that we do this right this time. Thank you.
Thank you, Dr. Apostle White. We have 3 more questions, so the first 3 that want to come here and stand and ask questions.
First, I want to say to Mayor Ostenburg, we really need to applaud you tonight. This is by far the largest group we've had. Secondly, when I looked in the paper and saw 4.5 years ago that the trauma center was closing at St. James, I was appalled. Some things ought to make you angry. When there are 4 on the north side, none on the south side, and a trauma 2 down in Joliet. I was so angry because I know that we have more intravenous trauma than the average neighborhood. On the north side, they're dealing with a lot of blunt trauma. But you got 4 hospitals there. Now, since I just heard Congressman, I thank God for you asking that question. Who determines where they go? The state. So now we need to sue the state. So if they don't want another lawsuit, Representative Flowers, you're just awesome, sister. I know you'll be helping us sue the state because even though you work it, I just know where you are. But we need to follow this. We don't need to let that drop because if your child, we got to add some names to this. They tried to tell us that there would be no bypass. We found out right away they were bypassing then. The young man in Country Club Hills was stabbed. He was stabbed on 175th Street, and South Suburban was right down the street. St. James was not too far away, and they took him all the way to Christ, and he died. I mean, we're talking about the mayor of Country Club Hill's son, who had to be flown down to the city. He died. I started having chest pains in my office one day, and they had to run in there to get me, and the ambulance came in, and my chest was hurting bad. I said, Lord, don't let these folk take me all the way to Christ. I said, if you take me to Christ, I'll sue you. You better take me over to Eagles right now. I wasn't going to die on the way to Christ, and God forbid a train, a traffic. That's a hell of a long ways to go down there. I say hell because some of us going and we going to Christ. But today is the best by far effort. That was a great start that we made in your office and had everybody, I thank all these representatives. But today, if we take this and get this information out, and pastors that are in the room, put it in the bulletin and make sure we pass it out. We're going to put it in the Gospel Tribune and begin to raise the issues again. Just as Salim had his hoodie on to raise the issue of Trayvon, and I had a hoodie on my altar today, and some Skittles and iced tea to make sure we don't let this boy die in vain. We got to do the same thing with this trauma center. Thank you. Thank you. I will raise my voice. Anybody here paying me but my church and the Lord. So I can say what I want to say and ain't got no repercussion, and I can be on whatever side is the right side, and every preacher needs to stay free enough to say what's right. Speak truth to power.
Thank you, Apostle White. Thank you for your leadership. These will be our final three questions, comments. Introduce yourself, please.
My name is Bernard Ostenburg from Hazelcrest. I've been in healthcare for over 34 years in physical therapy. 10 of those years were in the Air Force and military. So the outline to have a health system is there already, because in the military, you have a health system. Services are given to you early, preventive care is always provided. And I've always wondered if I got the service, why in the civilian world is so different that citizens are not treated as well as our military personnel. So the framework for a healthcare system is there. We just have to mirror that. And the system is not only talking about trauma care, but giving preventive care to our kids and to our youth so that they do not have to worry about a heart attack at 20 years old and 30 years old. The obesity rate is phenomenal in the African American and Hispanic community. So the issue is not only the trauma care, but total care, community care. So we need to focus on not only how can we help people who are in accidents, but how can we prevent the things that happen to our youth today who are dying younger than their parents. So my question is, how can we come together as elected officials in the Southland to deal with the issue today? Not waiting for the $10 million. How do we work today to develop a system where our kids are not the ones running to the hospital because of a heart attack or diabetes? So how can we work together to do that? I guess that's a question for the panel and for elected officials. Thank you.
Anyone want to take that? Dr. Raju wants to take that.
I think, as we discussed in my remarks, there must be a strategic plan. We need to sit down very quickly and figure out what is a total healthcare need and who does what. Instead of competing with each other, having 4 guys doing the same thing, we need to figure out who does what, where, when, and what we need to do there. If they don't want to do that, the government should be involved and probably make it happen in Southside. Otherwise, people will always go after the most profitable part of the system, and that's why we are in trouble now.
Thank you. Identify and let Congressman one quick comment.
I just want to comment very quickly. Brown versus the Board of Education is 5 cases, if I remember the history correctly, that have been brought together to be heard as Brown versus the Board of Education. It was 5 different cases of children being denied access to public schools. The state of Virginia, in reaction to the Brown decision, for example, shut its public schools down altogether for 4 years, arguing that they didn't even have to provide education for anybody, certainly if minority children had to go to school there. It just appears to me that all over this room, but particularly those of you who deal with patients, that you hear the stories that range from Bishop Jordan on back across to the stabbing on 117th Street. Everyone has the stories. Now, it just seems to me that the lawyers of St. James, the lawyers of the Healthcare Consortium, the lawyers of Ms. Artis' group, we got South Suburban mayors and managers, we all got lawyers, village councils for each of these villages. We ain't got to pay them no more money than we already pay them. They need to come together and just wait for us to find money that doesn't exist in the state of Illinois, waiting for us to find money in a 2-year appropriation process that once we get started, we may or may not get it in 2 years now that they've eliminated earmarks. And we can't keep going back to the same well every year for $10 million more dollars because there are other things out here got to be funded as well. We need a paradigm shift here. And we need our own version of Brown versus the Board of Education on the question of health disparities, for which all of these stories represent some part of why we're filing the lawsuit in the first place. And we need a decision from a judge that says the state of Illinois, DHS, putting 4 trauma centers there and ignoring us is against the Constitution. It violates equal protection. It takes too long for us to get from the south side to wherever the hell we're supposed to be going to keep from going to hell. And that's the context of the framework. And I'm just arguing that we're not using the best of we got our political minds here, we got our spiritual minds here, we got healthcare advocates here. Where are the legal minds that allow us to recognize that we got a disparity problem here that ought to be the basis of an equal protection lawsuit? That's number 1. And very quickly, number 2, I believe, this is my honest to God truth, based on 17 years of being your representative, I genuinely believe as slow as the court system is, it moves faster than governors in Illinois. That's my own experience. And what the issue is, the lawsuit is Healthcare Consortium, it's Health Southland Forum, it's SSMMA, it's ministers and clergy, it's the families of victims who've been violated versus Pat Quinn and the state of Illinois. Not in his capacity personally, but as governor and DHS and whomever else. That's what the lawsuit looks like. And it will be summed up to healthcare versus Quinn and the state of Illinois. That's the case we're looking for. And you know the stories. We just have to come together to file the action and force the federal court to force this legislature to do what it won't do on its own.
Thank you, Congressman. Introduce yourself and for a quick comment.
Good afternoon, ladies and gentlemen. My name is Ron Taylor, and I don't require a microphone because I am a voice for the voiceless.
Recording.
Very well. I'm the president and CEO of the County Patient Advisory Coalition. It's a healthcare advisory organization that works primarily with Cook County. We've done work with Commissioner Jerry Butler of Hospital Health Services. We've saved more than 4 of the South County clinics from being closed. And we also currently work with Representative Anthony DeLuca's Economic Development Committee, of whom we have made him privy to a proposal for hospital and healthcare services in the South Suburbs, of which the representatives have been very encouraging with us. Some very key points have been made here, and in regards to speaking prospectively, the aspect of the Affordable Health Care Act does address the first portion of the healthcare dilemma in America, which is healthcare insurance reform. Being able to reel in healthcare insurance companies and make them abide by certain credible facets that are needed by the people. The second phase is education and infrastructure, which is a crime and a very hurt portion of what we need. And that's primary care doctors. That is the forefront of proactive medicine. The third portion of it is deployment. Actually developing the healthcare network throughout the nation. And we have proposals as an organization that address all 3 of these matters through 2 important pieces of legislation proposal called the ECHO Grant Program, which is Educational Careers for Healthcare Opportunities, and also the PREP Act, which is a Physicians Reimbursement and Entitlement Program. Congressman Jackson, you shall be made avail of these informations and these programs as they are being developed. But let me just say to you that this situation does not go unnoticed. I also do work with the Village of University Park and the Economic Development Commission, and we stand as the only village that has the advantage of a state university which has a very successful nursing program, which we're looking forward to corresponding with and co-opting with to develop solutions to these matters. And so again, we thank you for the opportunity. I thank you for the opportunity to be able to speak this afternoon. And once again, Please stay fruitful, multiply, and just remember, it doesn't take courage to be a millionaire. It doesn't take courage to have billions of dollars. But what it does take courage to have is compassion. It takes courage to be able to reach out to someone and be able to lift them up. It takes courage to be a voice for the voiceless. It takes courage to be able to stand in the gap for those of whom truly need you. So let's please continue the courage that we're showing today. Thank you very much, everyone.
Thank you so much, Oscar, for your work. And one final comment before we close.
My name is James Doherty. I'm the Trauma Medical Director at Advocate Christ Medical Center. Commissioner Sims and I have met numerous times. She has been a very early advocate in this process, and I think everyone should give her a round of applause. Advocate Christ Medical Center is the trauma center serving this community right now. And there's no doubt that there is a maldistribution of trauma centers in this region. We know that. And we're making the best of it that we can, given the resources that we have. Advocate Christ Medical Center has spent millions of dollars to hire more trauma surgeons, to expand our inpatient beds so that we don't have as much bypass. The hospital is building over 100 more intensive care unit beds in the inpatient tower that hopefully in the next 5 years will eliminate the bypass problem completely. Okay? But these are steps that we're doing. To provide adequate trauma care, you need two things. You need the will and the resources. St. James had the will. They didn't have the resources. Trauma care is expensive to provide. There's just no doubt about it. There is a state trauma system. It is run by IDPH. How does someone become a trauma center? It's voluntary designation. You choose to be a trauma center. No one makes you a trauma center. And because it's voluntary designation, it's also voluntary de-designation. If you can't do it anymore because your hospital is going to close its doors or have to close one of its campuses, you can't do it. And so what happens is you close your doors to trauma and the system has to work around it. And that's what happened in July of 2008 when St. James de-designated. Funding is the issue here. In 2005, the state of Illinois, which was, we should all be very proud of this, the first state to have a trauma system, the first state to have a trauma center. In 2005, the state of Illinois, the stakeholders in the trauma system said, we're not doing a good enough job. We need a site visit from American College of Surgeons to tell us how to run our trauma system better. IDPH agreed. We had the American College of Surgeons come out, and they had two main recommendations. They have a state trauma medical director, a trauma czar, to administer the program so that things like this could be dealt with. You'd have an effective administrative mechanism to deal with patient care issues that arise from administrative changes. And the second thing was funding. Other states have taxes on your license tax, so that you pay $3 on every license tag. That goes into a trauma center fund. It gets distributed to the trauma centers based on need. We don't have that in the state of Illinois. Washington State, Pennsylvania, Maryland, they do. So we're behind. Illinois does have some funding. Okay, there is a trauma center fund. It's routinely rated by the governor's office. Okay, that fund is eaten up. Okay, and I can tell you that as the busiest trauma center in the state, we got the most money last year. And I can tell you it isn't enough to pay the salary of one of my trauma centers. It's not enough. Okay? So the reality is we need a better funding structure. Okay? If every patient had insurance, every hospital would want to be a trauma center. No one wants to turn away patients with insurance. But the reality is that trauma disproportionately affects people who are uninsured. Young, healthy people, people without jobs, young people. Okay? And that's the reality of it. So what we can do is improve trauma center funding. Now, how can we do that? What's going on in the state now? The state of Illinois is broke. Okay? The state of Illinois is broke. There's no funding coming down the line. IDPH has had this recommendation from the American College of Surgeons since 2005. Nothing's been done. The trauma stakeholders got together, came up with a strategic plan that specifically addressed a lot of these issues. It has sat on the desk at IDPH. So it's IDPH and the state legislature that has to make the difference here. That's where it happens. Okay? You have to change the way it's administered at the state level, enact the reforms that are recommended, get a better funding source that any hospital that wants to can be a trauma center. I'm fortunate. I work for a medical center that has the resources and the will to be a level 1 trauma center. Not only do we take care of the South Suburbs of Chicago, we take care of the city, everything south of 58th Street. Okay? Now, we just found out in July, we're going to have to take over northwestern Indiana. Lake County is now ours. Okay? So that means we might go on bypass to take care of someone from Gary while a kid in Park Forest is dying from gunshot. There has to be someone to mediate this. When I brought this to the attention of the State Trauma Advisory Board, they didn't know anything about it. I only found out because an EMS provider asked me to attend a meeting about it. So we really need more effective leadership at the state level to address these problems. And there is no doubt that the trauma community wants to fix this, and we want to save as many lives as we can. I don't call. I don't take in-house call. I take care of patients. 70 to 80% of my patients don't have insurance, and I don't care. It doesn't impact them. I don't care at all.
I work at St. James, and I'm a surgical tech, and I worked in the trauma center in surgery when we were there. And one of the things that the doctors were constantly talking about was the fact that they get these patients in from all around, and we're stuck with them. They stay there until they can walk out of the hospital. Where the hospital or in Indiana, we got some from Indiana that they wouldn't take their patients back once they were stable and needed long-term care. They would not take them back, and that was one of the reasons that St. James left the trauma center, because it just sucked us dry.
Well, and I think that's true. Advocate Christ Medical Center in the last 2 years has provided $11.5 million in unreimbursed care to the Indiana patients.
So do you have a system now where, say Park Forest brings you somebody, that community has to take them back when they're stable, and we would have to, take care of them for the long term, or are they sucking you dry?
Absolutely. There's no doubt about it. It's very hard to get a patient back to Indiana. Yeah. So this is actually fortunate where we have, someone at the federal level here, because that's an interstate issue. The state of Indiana has enacted laws that apply to us as their trauma provider that we had no say in. And the state of Indiana doesn't reimburse Medicaid from Indiana for very little for care providers at home.
Thank Mayor Ostenburg for his outstanding public forum of the week for a trauma center. Also thank Representative DeLuca, Representative Mary Flowers, Commissioner Sims, Dr. Raju, Jennifer Artis, Congressman Jesse Jackson Jr., and Deputy Chief Ziegel. And for the last word, here's Mayor Ostenburg.
Thank you, William McNary, for doing a wonderful job as our moderator. Give William a round of applause. There were a few people in the audience that had to leave that we do want to acknowledge. In addition to Mayor Covington from University Park, we had Richmond Park Mayor Rick Reinbold, who was here earlier. Flossmoor Mayor Paul Braun was here earlier. I know there are a bunch of other elected officials. If you're an elected official, wave your hand. Any of you left? All right. We're very gratified by the fact that there are so many elected officials who are here this afternoon, because hearing this message is important for everyone. We've heard a lot of things today, and the information that has been shared with us is invaluable, because it gives us more of a basis for moving forward with our campaign to do something about this. But I would just remind people of one thing, and this is vitally important, and it underlines part of what Congressman Jackson already told us. If you look at the map, and I'm sorry I did not bring a map that our fire chief put together for me. Fire Chief Bob Wilcox put together a map where he put these little red dots every place where there was a trauma center. And let me tell you something. You go on the north side, you're going to trip over trauma centers. There are so many of them. You go on the west suburbs, you're going to trip over them. Where do you find that there are none? In the south suburbs and the south side of Chicago. Now come on, folks. This has nothing to do with costs and things of that sort. This has to do with what we in the south suburbs have been struggling with for years. And that's that we're the Forgotonia of Chicagoland. And we can't let that happen anymore. What the Congressman said to us in terms of changing the in this region are what is truly important. Because we need to be able to flex our muscles in the South Suburbs as well as those folks do in the North and in the West. And we can do that. We can do that if we move forward with an economic development program that in fact will be successful. You know, I apologize to my fellow elected officials and to some members of the community. Up until 2010, while I was mayor of the city and I did as much as I could in the city, you know, my work job taking me into the city with the Chicago Teachers Union really impacted upon my time. When I retired in July of 2010, it really opened the door to where I had more time to work on some of these community issues. And let me tell you, I have just learned so much in terms of what our region needs. But it will only be addressed if after we leave this meeting today, we all carry the message further. So what I ask you to do is this. Glenna Hennessy and Rich Whitehead, who have put together a lot of this, along with so many others, Georgette Gladstone did just immeasurable amounts of work in helping us put all this together. But they're going to have a pad of paper out there. If you have not signed it and put your email address down yet, please do that. Because we want to stay in contact with everybody and keep this movement rolling. The Citizens Advisory Group will take the lead, but we need all of you to help. And we need people, you know, Mayor, in your town. We need people in Richmond Park and in Flossmoor and Olympia Fields. We need all of the folks in the South Suburban region, Harvey and Dalton and Phoenix, everywhere coming together. And I know that, you know, that Apostle, you have done some good work along with your fellow ministers in trying to pull that together. But the citizens are really what counts. Somebody said to me just a few minutes ago that, well, you know, you can't make this into a political rally. It's not a political rally. It's a citizens rally. You know, the election was held last Tuesday. That's over. You know, we are talking here about what our citizen needs are. I'm not running for re-election, at least not for 2 years. I mean, I don't know, but at least it's 2 years off. So it's not a campaign issue. This is an issue that was addressed so clearly when the panelists were talking about the fact that, and maybe somebody else's kid now, it could be our kid the next time. So thank you all so much for being here. Thanks to our panelists, Congressman. Sure. I never turned down the Congressman.
I want to make sure that we have some of the takeaways because we come to rallies and we get all fired up and then we don't leave with some takeaways. So let me just share with you what at least my interpretation of the takeaways are. Number one, I'm going to work, as I committed in my remarks, to bring the directors that you will designate of the National Institutes of Health, Dr. John Ruffin at the National Institute for Domestic Health Disparities. I shared that with Reverend Kreider and Reverend White to come here and to address us on the issue of health disparities and what NIH, a multi-billion-dollar funded institution, can do to help us with our health disparities problem at every conceivable level. You're also going to let me know what additional institute directors are necessary to come to our region where we can send an invitation to them to have them come, Brother McNary, and address us in the appropriate forum. I hope, and I'm not imposing my agenda on anyone, I hope that the village attorneys of various villages within the 2nd Congressional District who have people on their payroll, who is what they do anyway. You know what your fire departments need. I don't want to unheed what the fire chief, the deputy fire chief said about trauma and how far he's got to travel in a time. Those statistics for those times that it takes him to take a trauma 1 patient all the way to Stroger or anyone else, or anywhere else ought to be the basis of legal action filed by our region against the state of Illinois on the question of the absence of a trauma unit in federal court. And while we're suing Governor Quinn in his official capacity and the state of Illinois in their capacity as distributor of healthcare centers, healthcare trauma units, we might as well get ready to get our transportation lawyers together too and get ready to sue them on the basis of ain't nothing being built in our area. Everything is being built up on the northwest suburbs, but it's our tax dollars also. Once we head down the legal road, we can look at all of the issues and just meet them in court, because clearly we got the South Suburbs on Tuesday voted more than the city of Chicago in the 2nd congressional district. I am in Will County, I am Kankakee County and higher than the city of Chicago. 54% of my vote came from 708. That's where the votes are. So in short order, between now and November, all the politicians are going to see them same statistics, and they're going to be running all around the South Suburbs looking for what they do, dividing us up, asking us, the group, to join him, and then some, and we all split up again. But we unite behind lawsuit. Where are you on our lawsuit on healthcare? Where are you on our lawsuit on transportation? I would hope that we see the legal strategy as a significant part of our progress in this area. That is not to discount the extraordinary work that Deborah Sims has done at the county. Give her a round of applause. Extraordinary work that Chairperson Flowers and our Wiley and our other state representatives. Give them a round of applause. All of those who are healthcare oriented, we need a single focus on the disparity issue. And towards that end, since I did mention it in my speech, on April the 21st, with or without the politicians, and I'll be in the back passing out these 10 flyers I got in my pocket, with or without the politicians, at 5710 West Eagle Lake Road, we are bringing our own shovels on Saturday, April 21st at 9 a.m. for our own groundbreaking of the new airport. We're not waiting for the politicians to tell us to take our contract and give it to some people who've been fighting against us. We want economic parity and a new economic context for this region so that we can create jobs. Thank you very much. Those are some of my takeaways, and I will add whatever other takeaways you want to my list.